in the
Yeah.
show and everybody can see us and hear us. Oh,
All
yep,
right.
we're live. Here we go.
Live. Welcome, everyone.
Hi, everybody.
Great to be here with you on this live stream. Really excited to have with me today Cherish Thompson, my practice manager. I'm sure many of you have seen and heard about the work that we do over at Ovadia Heart Health, my telemedicine practice that sees patients nationwide. And none of that would happen without Cherish, kind of behind the scenes, running the show. So really excited to have her here today and to talk a little bit about restoring heart health, and really want to focus on the different approach that we're taking to medical practices here at Ovadia Heart Health. Before we get too far into that, I do want to give our medical disclaimer that we are not giving medical advice during this live stream. And anything we say, in a general sense, before you apply that to your health, you should check with your physician. And maybe by the end of this, some people might want me to be their physician and my team to be their medical team. And we'll certainly talk about how to do that. So Cherish, why don't we start just by hearing a little bit of your story, kind of, what got you interested in health and your background around health, and what ultimately led you to connect with me a few years ago, and that led to you becoming the manager of my, at that time, still young medical practice.
Yeah, well, thanks, Dr. Ovadia. So I'll try and make it very brief. I started off watching your friend Vinnie Tortorich's documentary. And at that time, we were thinking that this type of way of life, keto specifically, could help with some inflammation that a family member was having at that time. And it kind of led us down that health path. And one of the things that we both wound up doing was the CAC test. One of us wound up with a nice score of 0, the only test that you ever want to have a 0 on, right? And the other person in the family did not. And we were desperately trying to think, okay, well, what do we do now? We reached out to a couple of the known experts in the field of cardiac health and low carb, and I couldn't get anybody to get back to us. I reached out a couple different ways. So fast forward, I've been involved in the low carb keto carnivore community for, going on 4 years now. And you and I met while I was in a community group, helping out, moderating, coaching, those things. And, it was just kind of fate, because I have a 30 plus year administrative background in healthcare. And you at that time were just getting the practice up and running, and we met, and it was meant to be.
Yeah, definitely so. And that's almost 4 years ago now, 3 years, 3+ years ago now. And we've been blessed with the good problem, I'll say, of lots of people want to work with this team. And we've been scaling up this practice. We now have, other practitioners involved. Lisa, our nurse practitioner. We have 3 health coaches on the team, Jen, Krishna, and Chris, and a practice that has just continued to grow. And, I think part of the reason that people seek us out is because we do run our practice different, right? There's
Mm-hmm.
certainly the obvious, the main reason I would say that people seek us out, right, is because we have a different philosophy around health, right? The putting food first and looking at your diet and root causes, low carb, all of that stuff, right? But I think what really, you know, uh, what really keeps people working with us, right, is the way that we run our practice. And it's in a lot of ways different from the ways that most medical practices are run. So why don't we talk a little bit about, some of the things that we do differently here at Ovadia Heart Health. And I'm going to let you kind of pick the first thing, what you think is most important about what we do differently compared to traditional medical practices that people may be dealing with.
Well, I would definitely say I actually have two. First, the combination of having health coaches alongside with you and Lisa, our nurse practitioner, working in tandem on not just the medical aspect, but the lifestyle aspect and treating and working with the whole person. I think that's what makes our practice unique, is that we don't treat just the conditions that members come to us with. We treat them as a person and an individual. I've said that multiple times, and I'll continue to say it. When you go to a regular doctor's office, you have these list of conditions, and it's like, okay, well, you have high LDL, right? So we're going to give you a statin. They don't look at anything else. I've talked to many of our members, and they complain that they go to their regular doctor and they're doing all this hard work and they've lost a bunch of weight or they've gained some strength, and the doctor, the only thing they can focus on is the fact that their LDL is a little high. So that's what makes us so different, because we actually do work with you as a whole person. So that's the first thing. And the second thing I would say would be the advanced testing that we do. We do advanced blood work, some of the biomarkers I've never seen, even some of the folks that do the typical, LDL particle testing, that there are additional markers that we run that they don't run, and the imaging. Standard imaging for everybody, the coronary artery calcium score to start if you qualify for that. It's a game changer. And I have two family members myself who I can definitely say it probably saved them from having a heart attack, just knowing the information first that leads to more advanced testing to determine, okay, is this a lifestyle fix or do we need more intervention?
Yeah, definitely so. And I would echo what you said about it being a team effort. And that's something that's something different than we oftentimes experience. Yes, a lot of medical practices have, different practitioners, different medical practitioners, at least, like a doctor and a nurse practitioner. I think it's relatively rare to find medical practices that integrate, beyond that, and having health coaches, working with them. And, one of the things, honestly, that is continues to surprise me in a great way is, the amount of progress that the patients coming into this practice make before they even see me. The way our process works is that you typically are going to have a number of visits with our health coaches and with our nurse practitioner before you actually see me coming into the practice. It's just the realities of how busy the schedule is. And by the time I'm seeing patients, oftentimes they already have made great improvements, and they've lost weight, and their labs are improving, and they're feeling better. And the day-to-day implementation of what we recommend doesn't need to, wait for me. It isn't dependent on me telling the patient, what to be able to do. The health coaches are really instrumental, and having our nurse practitioner, Lisa, to be able to review labs and things with patients so that they can really hit the ground running. And that's one of the things that we try and do in our practice. We don't want to waste the patient's time. And honestly, we don't want the patient wasting our time, right? You got to have buy-in from both, and we're committed to helping them if they're committed to helping themselves. And ultimately, what we, try and get our patients to realize is them helping themselves is the most important thing. So that's been really just amazing and gratifying to see. Talk about, we are a telemedicine only practice. We don't have a physical office, telemedicine only. And that allows us to see patients, all over the US. But it's also a different approach. And maybe talk about some of your perspective on that as well.
Well, what I noticed just from, and actually was told to me by some of our members, the one great thing about being a strictly telemedicine practice is you're never sitting in the waiting room. If you get caught up in surgery, I'm getting a message that says, I'm being held up in surgery. Please reach out to this person and let them know. They're still in the comfort of wherever they are. It's not like they had to travel and sit and wait for, an appointment, and then to find out that, oh, you have to wait more because doctor got held up in surgery. So that in and of itself, I think, is a huge game changer, because it really does speak to that, the member and the patient's times are valuable too. So no more traditional sitting in the waiting room for 20 minutes, because your doctor got behind on rounds or had an emergency, and you'll never know because the receptionist won't tell you. You're just sitting there waiting, and then you go into a room and then you wait some more. So just the compression of time improves care. The amount of time that you and Lisa and our coaches spend with the members is beyond what traditional medicine does. You go to a regular cardiologist appointment, you might be there for 15, 20 minutes. If you've got a really good physician, they're going to spend some time with you, but they're never going to do a deep dive into your lifestyle. They're never going to do a deep dive. They just don't have time. The managed care system, which I've worked in for 30 years, is not set up for it. It doesn't allow for it. So this practice does, though. If there's a lot to unpack, we've got a good 60 minutes to help you unpack that.
Yes, and the appointments we have with patients, they're dense. Some of the patients, by the end of it, they're like, whoa, like too much, information at one time. And again, that's one of the advantages we have with the health coaches, reinforcing things, after and between appointments. We do like to be more engaged, I think, with our patients besides our appointments, which, tend to happen at least quarterly, and checking labs quarterly. They're messaging back and forth with us in the messaging app that we use. We have a secure messaging portal that allows patients to, communicate with us on a constant basis, and we really look for that engagement. Now, we have about 5 minutes. I do want to cover one other aspect that's different about our practice. And sometimes this, does kind of take patients aback, right? And they don't understand that we don't take insurance in this practice. And talk about why that is. And, most people see that as a negative, but really talk about why that's such a positive about our practice.
Well, if you take insurance, you have to follow their guidelines if you want to get paid. That is the be all end of all of it. And while we don't take insurance for the visits that we do, if labs or images are needed, we will work with your insurance company to try and get those things covered. But over the last 2 years of us working together in this practice, I have noticed that it's becoming increasingly more difficult, even when it comes to the advanced labs. That's why our practice, looks to offer cash options whenever possible. We have them for labs. We will probably continue to look at possible cash option opportunities for the coronary artery calcium scores are already cash, probably for the CT angiograms as well, because more and more these insurance programs are becoming more restrictive and thinking that, they know better than the doctor who's actually working with you and treating you. So that's pretty
Yeah,
much it.
and that was my primary motivation for setting up the practice this way.
Mhm.
When the insurance company is paying the bills, the unfortunate reality is the insurance company is sort of in charge of the situation. And, your doctor who's getting paid by your insurance company, when there's a conflict, right? The insurance company wins. They decide they're not paying for something. And, many times the doctor and then the patient kind of interpret that as, okay, we can't get that done. And I'd rather not, I'd rather be deciding with the patient what is relevant, what is important to do, and then we get that done. And oftentimes the cash pay options are quite affordable. So that's one other different thing that we do. Chris, behind the scenes, I think we have time maybe for a couple of quick questions, if there are any coming through on the live stream. Going to remind everyone, whatever, platform you're watching this on, Twitter, YouTube, LinkedIn, please make sure that you follow us, you subscribe. It really does kind of help with the algorithm, kind of getting us out there so that we can spread this our positive message and help more people that are in need of this type of care. And for anyone that might want to, find out more about how we work with patients and whether it might be right for your situation, go to ifixhearts.com/talk. And, you can get on the phone with a member of our team, no charge, for that call. And it's kind of a strategy session, right? One of the other things that we do differently is we're looking for patients that are right for us to work with. We don't just take everyone. It's got to be sort of the right situation.
Yep.
All right. I think I saw a question flash up there, although then it went back down. There we go. So the question says, my cardiologist basically said, take drugs and call me when you need another stent. And this is someone who is working with our team. And he said that Dr. Ovadia was able to, I was the first one to be able to get the proper test. And yeah, unfortunately, too often around heart disease, the approach is, come see me when you have a problem. And we didn't really talk too much about this, but we do like to take a much more proactive approach and stop it from becoming a problem. We don't want to wait until you have a heart attack. Let's deal with it now so it doesn't get. One other question coming in here before we wrap up. Calcified widowmaker at 714 Agustin, which is the score. that's used on a coronary calcium scan. Can I do carnivore? As I said, we're not going to give medical advice here, but I will say that I have many patients with advanced heart disease. Some of them have even, had stents or had bypass surgery, and I still recommend low carb and carnivore diets. The bottom line is, no matter where your heart disease might be, inflammation and insulin resistance are the primary factors that are causing your heart disease to worsen over time. And you got to address those. And low carb and carnivore diets are great ways to address those. And I don't see any reason that having heart disease would be a contraindication to eating nutrient-dense whole real food. And that's what it's all about. Nutrient-dense whole real food, carnivore, low carb, whatever kind of version of that might be best for you. That's what we help patients figure out. But for someone like, the person who asked that question, you do want a practitioner to be working with. It's not just, I'm going to eat a carnivore diet and that's going to magically take care of my heart disease and I can ignore my heart disease.
Thank you for saying that.
You have to be addressing your heart disease, and the diet is part of that approach. So find a physician, find a practitioner to work with that will take that holistic approach. So thank you, everyone, for tuning in. This has been a great conversation. The team here is trying to do live streams like this twice a week, and really just help, to further that conversation around health. Lots of exciting things happening in and around our practice. So come check us out. ifixhearts.com is where you can find everything about the practice. Social media, ifixhearts on all the platforms. And we have a number of exciting events. There's a number of conferences that I'm going to be talking at upcoming. We have tomorrow, I do want to push this to people. We're having an open session, kind of my State of the Health Address 2025. And we encourage everyone to come to that. Maybe we can quickly get the registration link for that up on the screen. You can go to ovadiahearthealth.com/wellness for that one and register for that webinar that's happening tomorrow evening. Look forward to seeing as many people as possible there. Have a good night and take charge of your health, everyone.
Hope to see you tomorrow. Bye.